As a caregiver, the more we know about the care that is needed for the person that we are caring for, the better. Respiratory ailments are one of those things that sometimes we do have to learn a little bit more in order to provide the best care possible. So what is respiratory failure? It's where the blood does not have enough oxygen to do its job. Many times this is reflected in the fact that there is either not enough oxygen or too much carbon dioxide, which can indeed affect the best performance of the organs of the body. There are many causes for respiratory failure. Hi, I'm Martin Forts with MartinCare, back with you again on this Caregivers channel. Now, these respiratory failure causes can be related to COPD, pulmonary embolism. Of course, these days we're dealing with a rash of problems associated with COVID-19, and there are other issues as well. What we're going to do today is familiarize ourselves a little bit more as caregivers with these issues. There are other conditions that affect the breathing apparatus, that is, muscle and nerve damages that affect breathing. ALS, muscular dystrophy, spinal cord injuries, strokes, and other issues affect and can affect breathing. Given all the issues that lead to respiratory failure, the caregiver must be vigilant and diligent about being concerned with low oxygen levels. The use of a pulse ox is one way of monitoring oxygen levels. But in more severe cases, shortness of breath, discoloration, bluish coloring of the skin and fingers can also be signs of low oxygen level. Now, carbon dioxide is also something that will have symptoms that will lead to the person being confused and, frankly, again, just simply short of breath. When ordered by medical professionals, oxygen tanks are ordered in order to make sure that oxygen levels are maintained. Now, backup tanks and the safe operation of oxygen in the home is something that caregivers should be and must be aware of. Now, a volumetric exercise device may also be added to the exercises that a person should be doing in order to increase oxygen levels. This is an incentive spirometer. Caregivers need to be vigilant in making sure this is used. The person that we're caring for may often not want to use it, but it is important to help increase oxygen levels, and so we're there to encourage them to make sure they use the device. Some individuals, while hospitalized, have a surgical hole placed in the throat, more specifically the tracheal area, called a tracheostomy. Now, a breathing device is attached to this in order to help the breathing of the individual. Upon discharge and where needed, the tracheal device may indeed stay upon discharge. So the care of the area and the breathing device are important issues that the caregiver can lend support in. There are other treatments like the volumetric exercises we talked about that are non-invasive in nature. These can include, and often do include, medications. Like other issues of caregiving, the person suffering from respiratory failure may have bouts of anxiety, stress, depression. These can be as a result of experiences with shortness of breath. Be loving, be patient, help them get through the moment for the best possible results. With that condition unconditional love that you always apply as part of your caregiving process. So that's it on our segment on respiratory care. Hope it helped. Hope that you'll be with us next Friday when we bring you another topic of interest to caregivers. Share this information with others. Like this channel. And I will see you here next Friday at this same time. Have a blessed and great productive week.